Hello everyone, today I'd like to introduce Ryan Mann, one of our researchers at the Singapore Eye Research Institute. Ryan is an optometrist by training, and for several years now he's been interested in how visual impairment affects our quality of life and the population. So Ryan, could you just introduce your study and let us know what you found?
Sure. Hi Audrey, thanks for letting me be here to present our findings. So what's happening is that we actually looked at the relationship between vision impairment and employment because due to Singapore's aging population, the government has decided to actually raise the retirement age from 62 this year, I think, to 65 by the year 2030, and this is going to increase even further. So the thing now is that there has been studies looking at how vision loss actually impacts on employment around the world, but not necessarily in the general population and not necessarily in Asia, okay, and also furthermore not really looking at in older adults. They mainly looked at the younger population. Okay, so now I think this topic is becoming more and more relevant, and which is why we decided to, hey, do we have enough data to actually look into this study itself?
So how did you go about, sort of like investigating this question?
Okay, it's good that you asked. So essentially, what happens is that the Singapore Eye Research Institute has been running a study for the past several years, I think for the past 12 to 13 years. We have this study called the Singapore Epidemiology of Eye Disease Study. It has over 10,000 participants, Chinese, Malay and Indians. Okay, it's a large population-based study. So right now we are looking at the 12-year follow-up already, okay? But for this study, we're actually looking at the 6-year data because we have completed all the 6-year follow-up data already. So we want to look at whether the vision loss itself actually impacts on the individual's ability to continue working over the past 6 years. Does it impact on their retirement plans? Okay. Does it impact on unemployment? And does it actually affect their level of employment, which is something that is not very commonly looked at in previous studies.
So this study involved people from what age group?
This study involved people from the age of 40 to 80 years of age. That's for the baseline assessment. So 6 years down the line, they will be obviously 6 years older, which is 46 to 86, roughly.
So
around.
what parameters did you look at in particular?
Oh, we actually did quite a large comprehensive clinical protocol. So we actually assessed their vision, okay. We actually looked at obviously their basic height, weight, okay. We took the eye photographs, okay, and we actually have an ophthalmologist, which is an eye-trained doctor, to actually look at the patient's eye to see, hey, if there's any vision loss, what is actually the cause of vision loss? Is it due simply to, not wearing the correct spectacles, or is it due to other age-related eye problems?
Yeah. What did you find?
Okay, I'm glad you asked. Okay, so we actually looked at a total of 7,400 participants in this study. So they were all, as I mentioned before, they were all followed up over 6 years. The first baseline assessment was between 2004 to 2011, and then the follow-up was between 2010 to 2017. So we looked at obviously their vision, okay, we classified them according using their visual acuity into mild and of course moderate and severe vision loss, okay, and we also look at their their job parameters. We asked them, what are you currently working as right now, okay, and based on their answers, we classified them according to the international classification of standard occupations, okay, so there were actually 22 different categories, so we had to look at all of this and we had to classify them accordingly, okay. So what we actually found was that, okay, we found that people who were actually visually impaired at baseline, we looked at two time points. We looked at baseline first, okay, and then we followed them up over 6 years because we had both data. Okay. At baseline, people with vision impairment were around 1.46 times more likely than those with normal vision to be unemployed.
Oh, that means they were 46% more likely to have unemployment.
Correct. That's correct. And then when we actually looked further into the details itself, right, we found that even those with mild vision loss were around 50% chance more likely to be unemployed already. And this actually doubled, okay, when their vision loss became moderate or severe. Okay, and then we also tried to look at, at follow-up, what happened to them, were there any cases of, vision loss impacting on unemployment? Unfortunately, at 6 years, I think there were really too few cases on unemployment. We couldn't really look at it, yeah. Okay, in terms of retirement, surprisingly, we didn't find any significant findings, okay, which sort of hinted to us that maybe vision itself doesn't really play a part in retiring, especially in those who are already working, okay? But what we actually found novel was that in terms of underemployment, okay, so we followed them up over 6 years, their occupation level, okay, their skill level actually changed over 6 years. We found that even those with mild vision loss was more likely to sort of downgrade, okay, their job levels actually degraded over time, okay, so it's around 50% more likely to actually find themselves at a lower job level after 6 years.
So from what you're saying, people with visual impairment have a 50% chance of being unemployed. And if they were employed at the beginning of your study, there was a higher chance that they became or downgraded their employment over 6 years.
Correct, that's correct.
What does that mean in actual terms for a person? Actually,
it's a good thing that you raised this point, Audrey, because the very interesting thing that we discovered was that 94% of these people with vision loss could easily, be corrected with just a simple pair of spectacles. Basically, they were just underpowered, okay? They could easily be corrected. And the thing is that obviously 6%, the remaining 6% were due to other age-related diseases that may still benefit from early screening. But this is really important to highlight because of the government's efforts to promote, continued employment, for the elderly people to maintain their functional independence. So this is something I think that we may want to highlight, especially to the government, to the employers, that you may want to conduct yearly screening for your elderly employees, okay, so that we can actually highlight to them, these are the remedial measures that you might want to take, okay, and this might in turn benefit the employees itself and allow them to actually maintain their quality of employment that they're
and their quality of life as well.
Exactly, correct. So the thing is, obviously there are some caveats to this study, okay, in the fact that we just asked them, basically we just asked them questions about their job, okay, at this point in time. We didn't really interview them in depth, hey, what was the reason why you left your job? What was the reason why you decided to downgrade your job level? Okay, so in the future we are intending to sort of investigate this because our group itself is actually conducting another population-based survey of people aged 60 years and above, and it has a very strong sort of interview component. So participants will have to undergo questionnaires for 2 hours. Okay, so I do believe that this study called Pioneer will actually give us a lot more information about what the situation is right now in terms of how vision loss actually impacts on the person, including the employment opportunities.
I think that's a very important question. I really look forward to seeing what you find.
Thank you.
Thank you very much, Ryan.